Good afternoon. My name is Taylor Angelisanti, and today I'll be speaking with you about assisted suicide. I plan to inform my audience that assisted suicide is beneficial in many certain cases, such as people in a terminal state. Assisted suicide is frowned upon, but in actuality, it is one of the best decisions that some people could possibly make. Could you imagine living a life of pain and suffering? Many are not able to have the option to determine whether they want to continue to live in pain or if they want to begin their life of resting in peace. It is important to see the benefits of ending your life medically to comfort yourself. Today I'll be speaking with you of the benefits of having the ability to decide if you want to medically end your life if in a terminal state. Let's begin with the process of assisted suicide. To begin the process of assisted suicide, the patient has to first be informed about the entire process and options of how to end your suffering. After the patient is informed, he or she has to make their final decision as to if they want to go along with the process. There are many different ways to go about putting someone to death medically. For example, they could use an overdose of drugs or even a lethal injection. The final step would be the physician performing the action or the patient performing it themselves. This is hard in many places due to the fact that it is not legal, which is why in many cases the patient actually performs the action themselves. But although the patient performs the action, the physician is at fault as well for being aware and promoting the situation. Now let's think about the patient making the decision. The patient is in so much pain and suffering that they are willing to take their own life. It is clearly too hard for the patient to be able to carry on and enjoy the life they are currently living. They would rather live pain-free in heaven, if so their belief, than in constant pain here on earth. Since we saw the benefits of this decision, we also have to think about the cons. For the patient, they have to take into consideration the impact this decision has on their loved ones. It is hard enough knowing one day we have to leave without your loved ones, but imagine the guilt of inducing that decision and deciding it yourself. The patient may also have to take into consideration their religious beliefs. Not all patients may be religious, but in the case that they are, they will consider what they are doing murder or suicide. After looking at these points, the benefits of allowing this action are more bold. Giving chronic patients the choice to either continue in pain or end their suffering should be considered a legal decision. Not legally letting people make this choice is causing them to attempt to commit suicide on their own in an unfitting setting. Legalizing this will ease the pain of many.
Well done.